Well, they're describing this variant as being 60% more infectious than the Alpha variant, the one originally associated with the UK that has dominated around the world until now. So the way that translates, though, is that we're seeing higher what we call attack rates, so the number of close contacts who are infected. And in this current outbreak in Australia, the one focused around New South Wales, the largest cluster, they're reporting consistently very close to 100% of close household contacts being infected. And that's quite different to what we've seen previously. And we're also seeing much more casual exposures infected as well. Again, a sign that this has a different infection and transmission pattern.
Can you give us some context about how quickly this spreads? There have been some reports in Australia that it can pass between people in seconds even.
Well, they did document one crossover point between two casual contacts, a case and someone else in the same shopping centre. And when they tracked the movements, they found the only time they were together was literally a moment, 15 seconds or so. However, if you look at the nature of it, they were close together. They're only 10 to 50 centimetres apart. And it looks like the person who contracted the virus from the description had have stepped into the space the other person had been standing. So they moved, they stepped into that space. If that case had just exhaled and this person inhaled, there's that element of just terrible luck that you happen to get that coincidence in terms of exposure. But what we're seeing is that coincidence is happening more often. So it does suggest that more cases now have that ability to shed enough virus that those even more transient transmission exposures now seem to be playing more of a role in as the outbreaks take off.
Can you tell us about how the vaccines are working on this new variant? Obviously, that's a huge concern and a major issue now when vaccine rates are ramping up around the world.
In terms of transmission, it does mean that Delta, given this increased spread, and the fact it's not covered quite so well by the vaccine as, say, the Alpha variant to reduce infection, that is a concern. But at the same time, it's still effective. So it is still pulling, if you're vaccinated, it pulls this variant, back to something more equivalent to perhaps the Wuhan variant, even more so than, what we've seen later with these more infectious variants. We've seen a case in Australia, for example. We had an outbreak linked to a party where there were some 40 people present. And so far we've had, I think, at least 28 cases from the one party. So again, a family gathering, but and so close contacts. But in fact, there were, I think, 6 people there, either fully or partially vaccinated, and none of those have yet become cases, even despite this incredibly high attack rate with others. So it does make a difference at that level. The good news is the data out of Public Health England shows that particularly if you have 2 doses, that again, the vaccines remain really effective against serious illness and hospitalisation. And in fact, for both Pfizer and AstraZeneca, with this Delta variant, we're still looking at something over 90%. So that's the good news. It still prevents that serious illness. And in fact, the Delta variant might not cause that same level of serious illness as we've seen in some other variants. So it's good news that the vaccine's still working against it, though, because with the just sheer number of cases, there is that risk that you will see people with needing hospitalisation.
Obviously, people around the world are really anxious to get back to normality as soon as possible. How do you think the Delta variant is going to affect plans for reopening, especially in places like the United States and Europe that seem quite determined to reopen their economies after so much time?
It's going to really challenge if you're setting your goals at zero COVID locally. If the hope was that the vaccines would eliminate the virus locally and ultimately eradicate the world, then this Delta variant shows that that's just not possible with our current vaccines. So I think it will shift the thinking. I think a lot of people are realistic about that, and it really is about keeping this at a controllable level. But equally, if we have breakthrough cases of infections, but we're continuing to see that it's relatively mild and short duration illness, that it isn't taking off into massive waves, then I think it will just have to act to increase people's tolerance for those sorts of numbers of cases in the community, even as you do open up. It's something they're monitoring closely. We're still learning about it. The risk is if you have a lot of transmission still happening, even if it's not problematic in the sense of the immediate health impacts, there is still a risk, particularly while this is happening globally, that you could see more variants arising. So whatever we do, we're still going to have to keep monitoring for variants of concern that could still be generated if you've got this replication happening in that transmission through populations around the world.